Hello and welcome to another episode of the Hindus in Focus podcast. I'm Zubeda Hamid, your host for today. Yet again, we are all talking about a virus we would much rather forget. COVID 19 is in the news again with over 4,300 cases and over 40 deaths as of June 4th. New subvariants, descendant from the Omicron lineage that was first reported at the end of 2021, are believed to be driving the spike in cases. So far, however, a majority of the cases have been mild, with very few requiring hospitalization, according to the government. So, is COVID 19 here to stay? Do we have any reason to be concerned about the new variants? Do we need our vaccines or booster shots again? And what, as individuals, can we do to stay safe? We discuss these questions and more with Dr. V. Ramasubramanian, Consultant Infectious Diseases Specialist, Apollo Hospital, Chennai, and Medical Director of the Capstone Multispecialty Clinic. Hello and welcome to the Hindus in Focus podcast, Dr. Ramasubramanian.
Hi, hello.
Thank you for being with us today. Let's get started. Doctor, the recent COVID 19 surge in India has been causing some amount of concern. Could you talk to us about what is behind the spike in cases?
Now, it appears that the COVID is here to stay. It started off with a sudden bang, but then now it is turning into probably what has happened to the influenza virus. In other words, the virus which came in initially was a very, very virulent strain which caused a high level of mortality, but subsequently it is morphed through mutations, which means basically changes in the gene structure, to a much milder variety which is likely to persist for several years. And like the flu, this virus periodically has been changing its form. There have been genetic mutations leading to various names given to the lineages, very fancy names initially, but now we are having difficulty coping with the numbers it's been given. And these viruses vary in their transmissibility and probably the virulence also. So, this antigenic shift, antigenic drift kind of a scene, which is seen in influenza, is likely to happen with COVID also, which means that there will be seasonal variations, typically in the Western countries where they have a winter and a summer, but in tropical countries where there is no definite seasonal variations, it's likely to be coming up once in maybe anywhere from 8 to 10 to 12 months. So probably we are looking at somewhere in the region of a 8 to 12 months surges which happen periodically in these countries, with infections caused by viruses which may sometimes be mild, which may sometimes spread very fast, and probably sometime in the future which may be virulent like the initial COVID outbreak also.
Right. So, doctor, you said that there are many sublineages of this particular variant happening now. Right now, as per reports, these the variants that are now driving the increase are all descended from the JN1 of the Omicron lineage, NB181, LF7, LF1, etc. Was Omicron, even when it originally came in November 2021, it was milder than its previous forms, correct?
Yes. When the outbreak started, we had the original Wuhan virus. Then we saw the nasty Delta strain, which caused a high level of mortality. And subsequently, the Omicron, and now all the lineages of Omicron, it's probably the grandsons, the great grandsons, and the great grandnephews. It's morphed into something which is very mild. So, what we see now, all the lineages, and I don't even bother to remember the names because it's getting very difficult, but fortunately they are all mild ones. Some of them are very strongly transmissible, but most of them tend to be mild. And when I say mild, I mean it does cause a fever, it does cause body pain, sore throat, pain in the throat, makes you miserable for 3 or 4 days, but the infection is as such very mild. It is not complicated, it doesn't require hospitalization routinely in most people. But in people who have comorbidities or who are immunocompromised, these can sometimes lead to complications warranting hospitalization and very rarely death. But predominantly, the infections are very mild. And probably the timing, the seasonality, the type of virus, all of them may contribute to how often we may see them in future also.
So, the trouble here seems to be not the severity of the infection, but the fact that it spreads rapidly.
That's right.
How fast, in the sense that is it a very far more than your normal cold cough viruses?
Could be, in the sense that we have already identified during the initial outbreak what we refer to as the super spreaders, typically seen quite often due to later research that this can happen in people who are obese, people who have dryness in the mouth, sort of a sticky saliva secretions. So you don't need to cough or sneeze even if you speak, because in certain people they can discharge large amount of viruses into the surrounding air, which may float around and cause infections. So these super spreaders are mainly responsible for the rapid spread. But even otherwise, the ability to reach out and stick to your receptors in the nose and cause symptoms is very high with these novel viruses, which show upsurge periodically, even though, as I said, they are mild. And this is likely to persist, likely to maybe get modified in future also.
Tell us a little bit about one question that's been on everyone's minds. Do we need a vaccine again?
Uh, it depends on which country you are. If you are in the United States of America, I'm told that they get a shot every year. So I know people who have had 7, 8 shots in the last 4, 5 years. But in general, it has been very clearly seen that both natural infection and vaccines give some amount of protection from future infections, not necessarily infections, but the severity of the infections. So the immunity may not prevent you from getting the infection, but it definitely makes the infection milder and prevents complications. So if you have had an infection in the past and probably had your 2 shots of vaccine in India, as we all, at least most of us, got it, your protection, your immunity is reasonably good enough to prevent complications. I repeat, it will not prevent you from getting the infections, but it will definitely make you stay healthy and come out of it much faster without complications. But in those people who have a weak immune system, people who are on medications to suppress the immune system, post transplant patients, patients who are on steroids for other conditions, patients who are very elderly or with several comorbidities, including obesity, heart failure, kidney, lung, liver disease, these patients' immune response may not be great. And along with the failure of various organs, when you get COVID, even if it is not too severe, this can lead to more complications. So, if you ask me, do we all need vaccines? Probably not. The very vulnerable, as I said, post transplant patients, patients whose immune system is very, very weak because of medications, may definitely benefit from vaccines. But unfortunately, we don't have any vaccines available in India. But if you happen to go to the US, make sure that you take the vaccine of the currently circulating strain, because that is the one which is likely to give you the best protection. But for routine people, no, I don't think vaccination is going to make a very big difference, because most of us have been, if not vaccinated, have had natural infections, which will give us some amount of protection.
Even if we did have the vaccines, which we don't at the moment, we have no stocks available in India, would they protect against this particular lineage, or would it not be optimal protection?
No, the older vaccines which were available in India will definitely not be of any use now. The newer mRNA vaccines, which have the current strain, the JN1 strain and the other strains, the LP strain, which are circulating, it is believed that after J1, JN1, they're going to go for the next vaccine, will have the newer circulating strain. If you take them, yes, they will give you protection, not the older vaccines.
Understood. That was very clear. Thank you, Doctor. Tell us a little bit about personal protection measures. India is a crowded place, so avoiding crowds is very difficult for most of us. What do we do? Do we mask up again?
Yes, especially if you're traveling and you're going on a holiday, it's going to make life miserable if you pick up an infection. Even though, as I said, it's going to be mild, but you're going to be put in bed, or at least, reasonably indisposed for 2, 3 days at least. So my suggestion is, if you're traveling, if you're going on trains or flights, or likely to be in areas where there is a gathering of people, functions, parties, be a little careful, especially for the elderly or people who may have complications. The young people may have a bit of a cough and cold or a feverish feeling for a couple of days, but at least probably for the next 2 to 4 weeks, by which time I expect it will pass away in most of these states in India. Make sure that if you're in crowds, mask yourself up. If you're traveling, also mask up.
You said that this was becoming a routine sort of an illness, right? So every 8 to 10 to 12 months, we're going to be seeing it again. So it's been 5 years now since the original pandemic. This is with us. This is going to be with us. It's here to stay.
Yes, we have had at least 5 or 6 upsurges in the last, what we refer to as upticks in the last 4 5 years. And this is happening periodically, mild, sometimes localized, not to the whole of the country, in a few states at a time. Right now, it's more in the southern states. It's typically in Kerala, Tamil Nadu, and Karnataka more often than in the northern states. So, this kind of an uptick involving a few states, localized population, a milder infection, which transiently happens for 4 to 6 weeks and disappears. Yes, it looks like that is going to be the norm for the future.
Tell us a little bit about the annual flu shot, doctor.
Right. Now, people have sort of accepted the flu. Most people think it is just a cough cold, which you're going to, keep you away from work for a couple of days, which is actually not true. Even though for the majority of the healthy people between the ages of, say, 5 and 60, it is what you think, whatever I said right now. But in young children, less than 5 years old, in pregnant women, in the people who have comorbidities, who are immunocompromised, and people who are elderly above the age of 65, flu can be serious. It can cause a pneumonia like the COVID, leading to deaths. In fact, flu is still the number one sort of agent which causes death among the viruses in all over the world. Even in India, probably over 300 people are dying every year because of the flu. We don't get the statistics. We don't test all the people for flu, but it is believed that flu not only causes death due to viral pneumonia, but flu also predisposes to cardiovascular and cerebrovascular accidents, basically heart attacks and strokes. Because flu increases the possibility of inflammation in the blood vessels, leading to blockages, which can, in the vulnerable, lead to heart attacks and also strokes. So, if at all there is one vaccine which I would strongly recommend everybody to have, it is the flu shot, which should be taken every year, because this has a 70% or higher possibility of preventing the flu or even then making it mild, which will definitely protect you. And it's just not the number of days which saves you from uh, leave. It prevents hospitalization, it prevents death, it prevents heart attacks, and it improves productivity. So, in fact, I would go one step further to say that all organizations, large organizations, should get their staff vaccinated, because that will definitely improve their productivity. And this should be done every year. When do you take the flu shot? It has been shown in a tropical country in India, it is not a winter situation, it is more related to the monsoon. So, Tamil Nadu and probably Kashmir, where the monsoon is sometime in late part of the year, October, November, December, they should take it before that. Probably August, September is when you should take the vaccine in Tamil Nadu or in Kashmir. But in most other states, including Kerala, Karnataka, Maharashtra, West Bengal, where the rains are much earlier, probably in June, July, the vaccine should be taken probably by April, May. That is the best time to take it. You know that there are two types of flu vaccines which are available, one for the southern hemisphere and one for the northern hemisphere. The northern hemisphere vaccine, which is for countries in the northern hemisphere who have winter in December, January, comes out by August, September. So Tamil Nadu and Kashmir should take the northern hemisphere vaccine, which is available by August, September. But the other states should take the southern hemisphere vaccine, which is available by March or so. So twice a year, the vaccine comes out based on which hemisphere it is. The winter is. So the winter is in the southern hemisphere during May, June. So this vaccine should be taken probably in April or May, the southern hemisphere vaccine in most of the states of India.
Understood. Tell us a little bit about what your message, last question, what your message would be to the audience right now. We know that the government has been urging people not to panic, but there is, as per usual, some amount of misinformation going around. What would you like to tell all individuals as to what to do right now in this situation?
To keep it very simple, I will say what my grandmother advised me, which is wholesome common sense. And I would still say that is the best way to manage these things. So, what are those sort of the golden words? One, make sure that your hands are always clean, which means wash your hands. If you go out and come back into the house, wash your hands. If you visit the toilet, wash your hands. Before you sit down to eat and after you finish eating, wash your hands. Simple things which anybody can do anywhere. So keep your hands clean. Avoid taking your hands near your nose. Don't fiddle around with your nose, your mouth, your ears. Keep your hands away from your face as much as possible. and the of course the usual things which I don't want to comment on, good food, exercise, good sleep, avoiding stress, and probably hygiene and sanitation. But along with that, I would add what my grandmother didn't know: vaccinations are probably very important in these days and times, especially for the vulnerable, to stay healthy.
When do you need to see a doctor, if at all?
If you belong to one of the vulnerable groups, if the fever lasts more than 2 or 3 days, yes. If you have any symptoms of breathlessness, giddiness, high temperatures, feeling unwell, see the doctor. But most of these viral infections in the healthy, as I said, last 3 or 4 days. If you're young, fit, and healthy with no serious symptoms, I repeat, giddiness, significant palpitations, high grade fevers, breathlessness, drowsiness, you can just pop in a paracetamol and stay home. Most importantly, don't go around spreading the flu cheer or the COVID cheer. Stay at home so that you protect others also. That will be the simple advice.
Nothing other than paracetamol?
Yes, nothing other than paracetamol. Maybe some cough lozenges and maybe an antihistaminic. Nothing else.
Thank
No
you so much.
antibiotics.
No antibiotics.
No.
Thank you so much for speaking to us today, Doctor.
Thank you. Thank you so much.